thasello ya rona e nngwe. We have zero tolerance to exploitation. Lento exploitation ka hlona ka tseba lona. Ho nsebedisa hore wena o tlatse mokotla sabsab a yona ga e tseba ka nnete. Le tšhelete e sa mphidising ke tla e bona e sa mphidisi. A ke jwale ha re bambeng baratuwa ba ka re tshwareng ka matla. The only thing is that we have our unity. Unity ya rona ke yona e tla re ntsha. Re na na kwetelele re lla. Thasello re na le yona go re fela. Re kopa tšhelete re sebeleditseng hle impete dipokotong tsa rona. Re tati ke re la rampa bosiwa ba ka re bitsa re theola kaofela. Tshepong ha e etse se nepaetseng. Mmuso wa Lesotho ha o etse se nepaetseng. Re ke ra etswa tjena ka rana ha bo. We are not second class citizens here. Ebe mohiri a tswa naheng ye nngwe ebe ke yena first class o tshego ka difatuku. Ka nnete difatuku tseno re tla di monyola matsogo.
We are having a dispute or a disagreement between Tsepong nurses or nurses working for Queen Mamohato Memorial Hospital as well as their employer, which is Tsepong. It started back in 2012, whereby nurses who are working at Tsepong were earning the salary that is equivalent to half of what their counterparts were getting in the government of Lesotho. So they tried to negotiate to say, we are a tertiary hospital here, I work long working hours without having breaks in between. I think I deserve a fair pay or more pay, looking at the intensity of the work that I'm doing. I'm receiving patients across the country. So as they were talking, they tried to talk to their employer, and their employer said the problem is with the government. Until both parties were saying it's you, they ended up not knowing who is the owner of this problem, who has to solve this problem. So they went on a national strike in 2014. This says it was 2 years later when this problem is still not resolved, and both parties, both the government and Tsepong, were agreeing that they are exploiting nurses. But the problem was who is going to pay them. So they went on a national strike, and I mean on a strike there at Tsepong as well as the clinics of Tsepong, the 3 filter clinics that are found within Maseru. They went on strike, and during that strike, that's when nurses were shot, they were brutally assaulted, and some sustained very serious injuries.
Ke sebeditse Tsepong ho tloha ka May 2011. Ke tsile ke sebetsa tleliniking ya Mabote. Ya ka morao ho mono Netcare be decide ho isa batho ba di special units Gauteng sekolong. I was one of the people ba ileng ba trained ke specialise ka accidents and emergency and trauma. So ke sebeditse Queen Mamohato tloha ka 2011. Jwale ka mwa di salary tsa batho di nyolwe ka khola ka 2012 ke la strike in Sapili 2013 ya ba se successful ka 2014 ile striking se nentse le sabe mo botshana mbo lo go sona re na go pa tšhelete mme re ne re eme mono mo gating tšhere ipinela taba tsa strike batho ba di tseba na di ka tsana ba ebe neng hana go ntse tsamaya ene le bo seng ka khola bo 8 maponisa la fihla ha fihla ka ne re re thabile ba re sa bana le bana ka ne re di etsa we ba sebetsi mo ba fihla le bana ba bona ba fihla na go ba batla mo tlo bua le bona pula ba le kule thunwanye le mo le thunyetswa go di ku ha e thuntswa ba re thaba re tlisa fela go ne re sa bona le photshela yentse ebe ka morao go mo no re a bona go se hle ba thunye ne le la ene ka khola ba 8 ka po 7 ba wetse di helmet maponisana ya ba se ba thunya na go ba thunyang ke bona re le ga hlokomela batho bana ba ihle ba se ya se ka tabana kana go nna ke ne ke le mongwe wa batho bana ba le pregnant strike mo ke ne ke le 6 months pregnant jwale na go nyeno re sentse re thunya batho ba ne ba baleya everyone was running for their life even na go ela fatshe ha go etse fatshe stampiti sa batho bohle ba baleyang se ne se tsama go dimaka ke ne ke sitwa go ema kana go eno mme go emeng haka ke a gola ke ne ke se ke bona maponisana go few meters away go re ka pushana was the last person ana ema fatshe maponisana ntsa mpona ho ke bileng ke nana ke khola ke se fuwe ke modimo be ha ba nthunya ke ne ke matha ke se ke kokobane ke piteditse mpa ke sa tsebe gona ke balela kae but kala ke la ha ke hula le matila go ye mo ne sibo mo fela ke monga yona ka fuma monga yona sa inotlela ka ke se ke bona ke ipate ka teng mme ke le ka bona batho ba bang ba nentse ba le ka thoko dikolo ntse haufi ha mabone sa ntse ba shapa ka sehlo ha ke phama mono ke ne ke le mongwe wa batho ba neng ba lemetse ibile ke lwa re tia go le ka taba pregnancy ya ka e ke neng ke sokotse ke a khola nako e telele ke le kae ke ne ke tsa fela ke ya go ke ne ke taboetswe le mangoleng mona na madi go ya tabile ke botha madi ka moa mono re le ga iswa ngakeng batho ba lemetse ba bang ba ne ba thuntse bohlogong ba matsohong ga iswa ngakeng ha re fihla makwanyane ke hona mo fela re ne re dingolwa go thusa hobane ka Tshepong re le ga hanelwa go kena go lo thusa ha re fihla makwanyane ra fumana skene sa teng se sa sebetse bakeng la ba khatshane go thwe re ipone gona re ka ya kae batho ba ne mahloka go kena bo ka sepetlele ba le ba kena ba iswa di-theatre nna ke mongwe ba le ba sokola gona jwale ke lo etsa skene kae until ka moa nako ke sa tsebe na ke ma re buelelletseng ebe ke gona ga dingolwang go kena one by one the following day e le gona motho o lo sheboa gore na e ka ba ga o na di-injuries tse etsaetseng ka gare so ka bokgutshwanyaneng ka rata ba tsena ke a di tseba tsa struggle sa rona mme tšhelete re le nne ya bantse re sa e fuwe la o etsetse ditaba tseno but unfortunately la re ne ba tshepisitswe ke di-minister tsa ka nako gore tšhelete e tlo ba teng e la ga khutlela ka gare we were severely punished ka gore re nkile 2 weeks striking tšhelete ya gona e la fokotsa ya nkuwa nna was one of the people e tšhelete ya e la nkuwa a toke strikele for 2
outside there, like you have seen the nurses, there are some who have bullet holes. And it was not a very nice experience, and they went back to work. They were forced to go back to work via using force, which is the police, and threatening them in whatever way that was possible then. So they went back, and they were promised that the two parties are looking into that issue. So each time they were complaining about this, you'll keep on being told about the issue of an arbitration. There's an arbitration between Tsepong and the government, and as we talk to the government through Ministry of Health, they will tell you the arbitration has not been doing what we think it should have done, because these are essential workers since 2015. There are no outcomes or whatsoever, except that workers continue to work, they continue to be exploited, and force continues to be used to force them to continue to be exploited. Okay. Yes, at Queen Mamohato Memorial, the pay slips that we are having, they are earning as low as 4,000. Counterpart gets up to 12,000 and something to 13,000. So when they are nursing assistants, they start from around 7,000 or more above in the government, okay. As well as child, because Tsepong and child, they are subcontractors or the sub-recipients of the money that is that the government gives them for them to render the service. Okay. So they are getting exactly the same money that their counterparts are getting at child facilities. That is, they pay like the government is paying because they are getting money. But when it comes to Tsepong, it becomes a problem. And as they get something like 5,000 and something to 6,000, while I said their counterparts on the other end, they are getting something like 12, close to 13,000, 14,000. The nursing assistants on the end, those ones who are getting 4,000, when you look at the government, they're earning that 7,000 that I mentioned, 7,000 close to 8,000 depending on when the person came. But here we are talking at Tsepong, we are talking of the people who have a technical expertise. That is different from all of us.
This whole exercise that's happened, that the nurses have been let go by the institution and given termination letters, has not been a very joyous or it's very sad, to be honest, for the country and for the organization. The whole reason is when you've had a relationship with somebody and have worked with them and they love that institution, you really don't want to sever that relationship with a termination. But really the matter was getting to a point where management could not accept labor practices that were totally and absolutely putting patients and the other staff that were in the hospital under duress. The whole reason was nurses went on strike. They picketed on the 1st of February, unhappy about our salaries. So there were negotiations going on between staff and management that whole week that did not get to any solution whatsoever. The reason we're saying any solution is because management's stance has always been, since 2012, when this whole matter started, was that we cannot give salaries any more than we are. The employees went on strike in 2013, and the whole reason was the discrepancy that was there in their salaries that was deemed to have occurred when Ministry of Health restructured its salaries for Ministry of Health employees as well as child employees. But for Queen Mamohato Memorial and its clinics, that didn't happen. And government always gave the same reason that our whole budget is given, a whole big chunk of our budget is given to you. So you should pay your employees from the same. But that's not neither here or there, because in the agreement, the salaries have to be at a certain percentage. But when they restructured, they were supposed to have had these discussions with this management of this organization, but that didn't happen. And indeed, it is so, like I've said, restructuring didn't happen. But these are very new nurses. Like new nurses, we mean people who are fresh from school. These people have worked since 2010, 2011 in this facility, and there are no raises to them. And this is supposed to be an institution that deals with complicated cases that come from other districts. So they felt it is quite unfair. So they resorted to this picketing, and the Nurses Association came later on, and in fact they wrote to management to say, we'd like to investigate and assist in this misunderstanding between the staff and yourselves on the salary issue. So management wrote to them. You should remember we're in arbitration. So when you've tabled your case before the courts of the law, you cannot then discuss it with someone else in those terms. So management wrote back to them and said, I cannot discuss this matter, it's an arbitration, and I cannot discuss the matter with a third party. So that word, third party...
Has there ever been any meetings of this arbitration?
No, I said they haven't been since. Yes, since it hasn't happened, and the lawyers who are supposed to sit on it are not from this country. They're South African. So it's been impossible almost for them to sit. So management then answered the Lesotho Nurses Association and said, I can't discuss the matter with a third person.